Have you ever wondered why certain Medigap plans get all the attention from brokers and social media while others fly under the radar? Well, recently I received a comment asking about the Medigap Plan L and Plan K. Then, as fate would have it, I came across an article from Telos Actuarial with the very same question. Why don't more people consider Plan K and Plan L for their Medigap coverage? Coincidence? Maybe, but it got me thinking. Are these overlooked plans hidden gems, or are we as brokers unintentionally doing you, the consumer, a disservice by not highlighting them more often? Well, in today's video, we are going to answer these exact questions. We will explore how Plan K and Plan L work, how they stack up against the more popular Medigap plans like the Plan G, the Plan N, and the High Deductible G, and then we will ultimately find out if they also deserve to be in the spotlight.
It's not easy being in the spotlight.
Let's start by understanding the basics of Plan K and Plan L. First, it is important to remember that these are still Medicare Supplement plans, which are also, of course, known as Medigap plans. This means that they provide secondary coverage to original Medicare Parts A and B, and they allow you to see any provider in the country who accepts original Medicare. So what makes the Plan K and the Plan L unique? The difference lies in how much of the remaining cost left by original Medicare that they cover. While many Medigap plans they aim to cover 100% of these costs, both Plan K and Plan L they take a different approach. But before we describe that different approach, as a reminder, my name is Cameron Giardini with Giardini Medicare. Whether you're looking for Plan K, Plan L, or other Medigap or Medicare Advantage options, the best way to do so is by using an independent broker. If you would like to connect with one of our brokers, we will provide you a link in the description for you to do so. You can also scan the QR code you see here on the screen to join our private Facebook group where we can give you more specific answers to the Medicare questions that you have. Now with that out of the way, here is one of the standout features of the Plan K and the Plan L. They are the only Medigap plans with a true stated maximum out-of-pocket limit, or MOOP for short. Now that might sound like a major selling point, but don't feel pressured to enroll in these plans simply because of that feature, and I'll explain why in just a moment. When we look at the standardized Medigap chart found on page 76 of the 2025 Medicare and You Handbook, you'll notice something interesting. Plan K and Plan L, they are the only plans that don't offer 100% coverage for various out-of-pocket costs that they do cover. Instead, they provide partial coverage of either 50% or 75%. For example, with Part B covered services like doctor visits and outpatient care, original Medicare covers 80% of the Medicare approved cost after you pay your annual Part B deductible. For 2025, this annual Part B deductible is $257. So what happens with the remaining 20%? That is where the Medigap plan comes into play. A plan like the most popular Plan G would then cover 100% of the 20% that remains after your Part B deductible, leaving you with no additional out-of-pocket costs. But what about the Plan K and the Plan L? Instead, they share a portion of the remaining 20% with you. Plan K would cover 50% of the remaining 20%, while Plan L would cover 75% of that remaining 20% not covered by original Medicare. I know all these different percentages can get confusing, so let's break it down with a simplified example. If you have $1,000 in Medicare Part B approved services in 2025, here is how things play out. First, you pay the $257 Part B deductible. Then, Medicare covers 80% of the remaining $734, leaving you responsible for 20%, or $148.60. Again, this is only if you have just original Medicare without a Medigap plan. Instead, if you were enrolled in a Plan G, the Plan G would then pay the $148.60 on your behalf, which leaves you only responsible for that $257 Part B deductible. Now with Plan K, your Medigap plan would instead cover 50% of that remaining $148.60, which means after your deductible, you would have to pay $74.30, which again is half of that 20% that remained after original Medicare paid its portion. With Plan L, you would only pay 25% of those remaining costs, which would end up being $37.15. And of course, like we mentioned, with Plan K and Plan L, you are still responsible for paying that Part B deductible in this scenario. So with Plan K, of the $1,000 in Medicare Part B approved services, you would pay roughly $332 out of pocket, and with Plan L, it would be $294. And lastly, with Plan G, you would only pay the $257 Part B deductible. That same partial coverage with the Plan K and the Plan L, it does apply to other Medicare costs. This includes things like the Part A deductible and skilled nursing facility copays. And you can see this more on the chart from the Medicare and You handbook. For example, with the Plan K, you would have to pay 50% of the Part A deductible, which in 2025 is $1,676 per benefit period. So in that case, you would actually be responsible for $838 with the Plan K. Plan L would instead cover 75% of that deductible, leaving you with $419 to pay towards the Part A deductible if you are hospitalized as an inpatient. As a reminder, the Part A deductible, it is not a once per year deductible like you might think. Instead, it is once per benefit period, which means you may be responsible for paying this deductible more than one time throughout the year if you are hospitalized as an inpatient after not receiving inpatient care at a hospital or skilled nursing facility for 60 consecutive days. So again, the key to remember, it can happen more than once. Although we won't get into the weeds with it, the same 50% and 75% coverage from the Plan K and the Plan L also applies to the cost associated with stays at a skilled nursing facility, and you can see here on the screen the 2025 cost for skilled nursing facility coverage. Last but not least, like we have talked about in our other videos like the Plan N versus the Plan G video, neither Plan K nor Plan L cover the Part B excess charges. Overall, when looking at the coverage that Plan L and Plan K provide for different services, the key takeaway is that these Medigap plans, they are designed to share more of the cost with you, and it makes them feel different than the more comprehensive plans like the Plan G that you are likely to hear about. Now, whether or not they make financial sense, we will discuss that very soon. But first, let's talk about the maximum out-of-pocket limit, or the MOOP, which sets the Plan K and Plan L apart from the other Medigap plans. While most Medigap plans, they don't have an official maximum out-of-pocket limit listed on the Medigap plan charts, the more popular plans, they often cover most of, if not all, of the Medicare-approved cost after you meet the Part B deductible, making your out-of-pocket expenses predictable and low. Plan G, for example, might not show as having a maximum out-of-pocket limit, but the fact of the matter is that for Medicare-approved services, you won't pay more than your yearly Part B deductible. Also, an enrollee in the High Deductible Plan G would not pay more than $2,870 in 2025 for Medicare-approved services. Now, I don't know about you, but both of those scenarios sound a heck of a lot like a maximum out-of-pocket to me. However, with Plan K and Plan L, the MOOP is an actual number that limits how much you'll pay for Medicare-covered services. For 2025, the MOOP for the Plan K is $7,220, while Plan L, it is $3,610. Once you have reached that maximum out-of-pocket limit, your plan then covers 100% of Medicare-approved costs for the rest of the calendar year. To help you visualize how this could work, let's say you are enrolled in a Plan K and you have $2,000 in Medicare Part B approved services early on in the year. You would first pay the $257 Part B deductible, and then Part B of Medicare would cover 80% of the remaining $1,743, again after that deductible portion is paid. This leaves 20% or $348.60 remaining. Plan K would then cover 50% of the $348.60, which would actually be $174.30, meaning you would have to pay the $174.30 that remains out of pocket. When we add the $257 you paid for the Part B deductible to the $174.30 you will have also paid, you will have paid $431.30, which would go towards your $7,220 maximum out of pocket. This would leave you with $6,788 of your potential out of pocket spending limit left for the year. In that same $2,000 billing situation with the Plan L, you would have instead ended up paying roughly $344 out of pocket, leaving $3,266 of the $3,610 MOOP remaining for the year. As you can likely tell by now, reaching the maximum limits for these two Medigap plans, it is not easy. In fact, for Plan K, you would need to receive roughly $69,887 in Medicare Part B approved services in 2025 for you to actually reach that maximum. For Plan L, it would require about $67,317 in those same Part B services. Also, keep in mind that is the Medicare approved amounts that you would have to reach, which are typically much lower than the actual total billed amounts that a provider would submit. Although with all that being said, we don't really have much data for how many people actually reach their Plan K or Plan L maximum out of pocket. But we do have a hard time believing that it is more than a small handful of people.
Oh, it can't be that many.
Another important detail to keep in mind is that the MOOP limits for the Plan K and the Plan L, they're not set in stone, and in fact, they tend to increase every year. For example, back in 2006, the maximum limit for the Plan K was $4,000, and Plan L, it was $2,000. Since then, these limits, they have increased by about 3.16% annually, and you can see on the screen how they have increased over the years. Now, if this trend continues, we can project higher maximum out-of-pocket limits in the coming decades, as you can see here. We will consider these projections when we compare the long-term cost of the Plan K and the Plan L to other popular Medigap plans very soon. When it comes to comparing different available Medigap plan letters, the real question always comes down to value. What are you paying versus what coverage are you receiving? So how do the Plan K and the Plan L stack up against the more popular options like the Plan G, the Plan N, and even the High Deductible G? Let's start with what we know. Plan G is by far the most comprehensive option available for newly eligible Medicare beneficiaries, again covering 100% of Medicare approved cost after you pay your yearly Part B deductible. Plan N, while slightly less comprehensive, still covers most cost but does come with lower premiums in exchange for up to $20 copays for doctor's office visits and up to $50 copays for emergency visits when you're not admitted. And of course, Plan N does not cover Part B excess charges. In comparison, Plan K and Plan L, they offer less coverage but typically come with lower premiums. According to that same article from Telos Actuarial, these plans are positioned as budget-friendly options, especially for healthy individuals, which of course are people who might not expect to use many medical services. Their analysis, it found that the Plan K premiums, they were about 40% of the premiums of Plan G, while Plan L premiums were roughly 70% of Plan G premiums. But unfortunately, we disagree with this analysis.
Why would you say that?
When we run our own quotes, we see a very different picture. For example, in Austin, Texas, the lowest premium for the Plan G, it is not $165 per month, which was used in the analysis by Telos. Instead, there are other companies offering Plan G as low as $103 per month. When we compare that premium to the lowest available premiums for the Plan K and the Plan L in that same area, the numbers start to tell a different story. Plan K's lowest premium is about $63 per month, which is actually about 61% of the $103 per month Plan G. This is not the same as the 43% difference reported by Telos. For Plan L, the lowest premium is $106 per month, which is actually higher than the $103 per month Plan G premium in this case. This discrepancy, it becomes even more apparent when we simply look beyond the Plan Gs from United Healthcare, which are the rates that we believe Telos used for their study. While United Healthcare is the largest Medigap provider, its rates often do not reflect the full competitive landscape of all available plans from different insurance companies. Also, when we include other popular Medigap options like the Plan N or the High Deductible Plan G, these comparisons become even less favorable for the Plan K and the Plan L. For instance, across multiple states, we found that Plan K premiums, they range from about 45% to 60% of Plan G premiums, and they were 60% to 80% of Plan N premiums. However, they were up to 187% higher than the high deductible Plan G premiums. Plan L was unsurprisingly even less competitive, with premiums ranging from 75% of Plan G all the way to exceeding Plan G premiums in some areas. Compared to Plan N, Plan L premiums varied from slightly lower to Plan N up to as high as 134% of the Plan N premiums. And against the high deductible Plan G, Plan L premiums, they were often 3 times higher. These numbers, they show that while the Plan K and the Plan L, they might seem like affordable alternatives on the surface, but they often don't provide the savings that you would expect when compared to other Medigap plans with more robust coverage. Now, to ensure we were not cherry-picking our numbers to just a handful of favorable states and Medigap markets, we of course mapped the lowest available monthly premiums for the Plan K and the Plan L in each state where they are available. The prices on the screen reflect the premiums for 65-year-olds and its average between males and females. We also compared these premiums to the Plan G, the Plan N, and the High Deductible G, so you can see how these numbers vary across the country, except in states like Wisconsin, Minnesota, and Massachusetts, where the standardized Plan K and Plan L are not available. On the screen, you can see how Plan K premiums compare to Plan G, Plan N, and the High Deductible G in each state across the country, so feel free to pause the video here if you need to. Similarly, here is a map of the Plan L premiums and how they compare to the other Medigap plans. And you can see that the monthly premiums with the Plan L are likely to be closer to the Plan G than you may have expected. Although monthly premiums, they are important, they are of course just one piece of the puzzle when choosing a Medigap plan. What you pay today is important, but equally important is how much these premiums might increase over time. And that is especially true for plans like the Plan K and the Plan L, where the initial cost savings are what make them seem more appealing at first glance. According to Telos Actuarial, Plan K and Plan L, they do benefit from having lower loss ratios compared to their more popular counterparts like Plan G. A loss ratio is essentially just insurance jargon that reflects how much an insurance company spends on claims versus how much they are collecting from you in monthly premiums. Plans with lower loss ratios often experience smaller rate increases over time, which is exactly why Telos Actuarial says that Plan K and Plan L, they might be worth considering for rate stability. However, again, our analysis paints a slightly different picture.
Different colored paint? I wanted different colored paint in the spots.
Based on our analysis of looking at dozens of different Medigap company increases across the country over several years, Plan G has had an average annual rate increase of about 6.5%, while Plan N's increases are slightly lower at 4.5% per year, and the high deductible Plan G stands out with the lowest average annual increase of just 2.5%. Now we'll look at Plan K and Plan L increases. Using the data from United Healthcare, which is by far the most competitive carrier for these plan letters nationwide, we found that from 2020 to 2024, Plan K experienced an average annual increase of 6.4%, while Plan L averaged 6.12%. These rate increases are very close to Plan G, and they are higher than both Plan N and high deductible Plan G. Although it may seem unfair to only use the rate increases from United Healthcare,
sure seems fishy.
We didn't think it was fair to include the low average increases for a company like United American, where Plan K and Plan L premiums, they are not competitive, and the company also has Plan K and Plan L enrollment numbers, which are virtually non-existent, as you can see here from their filing with state departments of insurance. This means that while Plan K and Plan L, they might have slightly lower premiums at the start, they don't necessarily offer the long-term stability you might expect. And since in many cases you do need to go through medical underwriting to change from one Medigap plan to another, it is crucial to consider how these rate increases could impact your premiums over time. To illustrate this, we modeled the 25-year cost trajectory for the Plan K and the High Deductible Plan G using average premiums and average rate increases for our home state of Michigan. For out-of-pocket medical expenses in these projections, we assumed $1,600 out of pocket annually for the High Deductible Plan G, and we do this because of an AARP study which says that that is roughly the amount the average Medicare beneficiary will spend out of pocket in a year. For Plan K, instead, we used $800 in annual spending to reflect the 50% cost share structure that that plan has. Over 25 years, even with these assumptions, the High Deductible Plan G came out ahead in total cost. Now, these are just projections, and it is not going to tell you exactly what these plans will cost over time, but it's something to think about. For Plan L, the story really is even less compelling. Its premiums, they are often as high or higher than the Plan N, but Plan N simply provides much stronger coverage. Plus, just like with Plan N, Plan L does not protect against Part B excess charges, so it doesn't even have that as a leg up on the Plan N. Lastly, Plan L has higher average rate increases based on what we found compared to Plan N. This essentially eliminates any potential long-term advantage, and it makes Plan N the clear winner when doing cost projections over time compared to Plan L, in our opinion. To go back and answer the question that we posed at the beginning of the video, are brokers doing a disservice by not talking more about Plan K or Plan L? The short answer, in our opinion, is no. It's not that these plans are being intentionally overlooked. Instead, they simply don't provide as much value as the other Medigap plans in most markets for most Medicare beneficiaries. As brokers, we aim to simplify the Medicare process, and we focus on plans that offer the right combination of coverage and cost. For most people, that means highlighting options like the Plan G, the Plan N, and the High Deductible Plan G. These plan letters are more widely available, they can have stronger coverage, and they can often make more financial sense over the long term. Unless something changes drastically in the market, Plan K and Plan L will likely remain niche options. Speaking of niche options, there is a unique situation where the Plan K might make more sense, which is if your health prevents you from qualifying for most Medigap plans. UnitedHealthcare, they offer what is called Level 2 pricing, which is available for some individuals with certain health conditions who might not qualify for most Medigap plans with other insurance companies. In Michigan, for example, a 75-year-old with a Level 2 premium for Plan K might pay about $140 per month. Now we compare this to $400 per month for that same individual enrolling in the Plan G with Level 2 pricing. Now don't get me wrong, this does not mean that the Level 2 Plan K is a guaranteed option for anybody with health issues, because you can certainly still be denied by this coverage. But it can provide an option for those wanting to transition from a Medicare Advantage plan to a Medigap plan, and they are finding themselves with very limited options due to their health status. If this applies to you, Plan K with Level 2 pricing could be the stepping stone you need to get Medigap coverage. Ultimately, because Plan K and Plan L, they are not likely to replace Plan G or Plan N anytime soon in terms of popularity. Make sure you watch our video next about the Plan G versus Plan N debate.